When it comes to mental health resources, experts say the pandemic has highlighted a lack of access for minority populations, and in some cases, it's made it worse.
Yeah, in this morning's Mind Matters, Team 12's Jen Wahl spoke with a panel of experts about what can be done to improve mental health care moving forward.
What's being done to achieve mental health equity across minority populations?
There's a lot of stigma attached in minority communities about saying that you have a mental health problem and seeking treatment.
Culture, privilege, things that come into play there that really create barriers.
Caregivers have 40 to 70% higher rates of depression and are at higher risk of substance abuse because of the stress.
Are likely to be women, right?
Exactly.
I think that we really have to normalize taking care of brain disorders on the same level that you would take care of your heart disease, diabetes.
Why is there a disparity? Is it access? Is it cultural? Is it societal?
Yes, all of those. All of those.
I've noticed that as a barrier is just not having enough BIPOC providers.
Just looking at Black psychiatrists, 2% of all psychiatrists.
Being able to talk to someone who kind of knows more about your lived experience and is kind of, if you like, closer to your community is so important in terms of really to help kind of transmit information and also really to help kind of lasting behavior change.
How can 2% of psychiatrists take care of all those issues? We can't.
What can be done to remedy and improve these disparities that we're seeing here?
Having conversations like these are key. Building networks of allies are key.
We really have to all take responsibility for this, no matter what our profession is, and see whether from our area, can we do something?
Thinking about achieving mental health parity, you have to both think about the causes of kind of mental health decisions, in addition to then how do we think about recovery and actually alleviating the impacts of some of those problems.
You know, better wages, paid leave, access to childcare and elder care, better internet infrastructure so that people they have the time, the money, and the tools to access the care they need.
And just also BIPOC providers leaning into each other is incredibly important.
Like Stephanie's saying, building networks of people who may not look like you, but are willing to discuss your experience and are allies and empathetic.
In Phoenix, I'm Jen Wahl.
And we will have more stories addressing mental health awareness throughout the month of May. To find this story and others like it, just head on over to 12news.com.